Okay, so hello and welcome to this public meeting called What's Going On? We Aren't Ready for a Winter Crisis. This evening's meeting is hosted by NHS Staff Voices, which is a network of NHS staff across professions, across trusts and across unions, all of whom are interested in preserving and rebuilding the NHS. It's also part of the wider campaign Keep Our NHS Public, and therefore part of the demand for an NHS protected from further prioritisation and commercialisation. So I want to start by saying I hope everyone is well. We are currently living through a global pandemic, and in the past month, we have seen the situation significantly change once again. As the number of cases increases in this country and in many parts of the world, so does the display of confusion from the government. This evening's meeting will be focusing on the handling of the crisis by our government thus far and the pressure we have seen placed on an already systematically dismantled and undernourished National Health Service. We will be discussing what could have been done differently and whether or not we are prepared enough to ensure that we do not see a repeat of the summer with the highest number of deaths in Europe, but also whether or not we are prepared enough to ensure that we do not risk the lives of health and social care workers unnecessarily. So with us this evening, we are joined by Karen McDougall, Elly Badcock, Helen O'Connor and Allyson Pollock. Each of our speakers will speak for 8 to 10 minutes and we will then move to a question and answer section. So please do leave your questions in the Q&A or in the chat section of the Zoom interface, and likewise on Facebook, please do put your questions for us put to the panel. And I do apologise if we don't get to all the questions. I'm going to try my best. So without further ado, I'm going to go to our first speaker, who is Karen McDougall. Karen is a nurse working in the NHS, and she's also a member of NHS Staff Voices.
Hi, thanks, Alia. I'm Ken, short for Karen. I'm an elderly care nurse working in the east of England. I work on a non-COVID receiving ward with a fantastic team of caring, compassionate people, and this reflects our experiences. One of the big issues at the beginning of the COVID crisis was a shortage of PPE. Despite reassurances from the government about the availability of appropriate equipment, we found a distinct lack of it. Initially on my ward, we had none. Then when it started filtering through, and I'm only talking about surgical masks, it was only in small amounts, not even enough for one for each member of staff. Further stock did eventually arrive, but it was still only enough for one to be worn all day. We had a short period when we had enough for us to change our masks at lunchtime, but then further shortages reduced us to one mask a day. Every day brought tales of hospitals and care homes and community nursing without adequate PPE. And for a while, the guidance changed on a daily basis, seemingly to reflect what was available rather than what offered the best protection. The news carried endless stories of huge quantities of PPE that were purchased but never arrived, or when it did arrive, wasn't fit for purpose, and about how the government had been counting each glove as single items to make their data look better. We watched all this in dismay. We're an elderly care ward, and we listened in horror at the rising death toll because patients positive with COVID were being discharged into care homes. We heard that death toll knowing that we had contributed towards that. And then COVID arrived on our ward. We'll never know whether a member of staff brought it onto the ward or whether a patient slipped through our testing protocols. But when it arrived, it moved quickly through the ward, infecting several of our patients and most of our staff. COVID did, however, bring visors with it. They looked like they'd been made by local primary school children, but we were grateful to receive them. We then watched as MPs broke lockdown rules without consequence. We saw the public health experts being sidelined for speaking the truth. We knew the chief nurse had been removed from the daily briefings because she declined to support a special advisor when he went for a drive to test his eyesight. The Prime Minister and his cabinet clapped us, but they didn't give us more PPE or better working conditions. And now, as we head into winter, the anticipated second wave looks like it's here. Do we think the NHS is ready to cope? The short answer is no. We all know the NHS struggles to cope with winter without COVID, and we are dreading what COVID might look like on top of the normal winter pressures. We're hearing rumours that PPE is still in short supply in some areas again, despite government assurances to the contrary again. But our concerns now are much broader than PPE. We're worried about our mental health, our physical health. Will the NHS survive? Will the public support us again, or is their patience running low? I have friends and colleagues who work on COVID receiving wards, who work in critical care and in ITU, those who work in the community and some who work in other trusts. And like us, they are concerned about what is coming. Those working in high dependency areas aren't being told of their trust plans for managing COVID, and they are already working over capacity and are concerned about where those adequate staff numbers are going to come from. Emergency departments hit the headlines most winters when insufficient bed numbers impede patient flow. Winter is always expected to be bad, but there are concerns that adding COVID on top of the usual challenges will bring hospitals and staff to its knees and their knees. The government is already talking about discharging COVID positive patients to care homes again. To those of us in elderly care, this is immoral and unethical and not something that we can do without being pressurised to do so. We are already mired in the breakdown and separation of health and social care and bang our heads constantly against a system that is failing to care for some of our most vulnerable. We work in healthcare and elderly care because we want to protect and help our patients, not knowingly send them to lonely death where they will put other residents and staff at risk. The NHS has had a huge morale problem for a long while, and it has been exacerbated by COVID. There are growing concerns about the mental health of staff, already stressed beyond belief by the lack of investment, the ongoing privatisation of services, and the resulting poor care that we feel we are being forced to give. And COVID has made so much worse. And now trust between the government and NHS and social care staff has been pushed to its absolute limit. Government continues to privatise our services around us, and they continue to refuse to acknowledge the pressures that staff are under. Unless you count yesterday's revelation about a snack box, they are refusing to consider a bonus or pay rise, while giving billions of pounds to private contractors who are failing to deliver basic services. In addition to failing spectacularly, these contractors have no penalty clauses in their contracts, but we, as nurses, can be reported to our governing body for the slightest misdemeanour. We listen to MPs constantly gaslighting the public about the failure of Serco track and trace and realise that the government does not have our or the NHS's best interests at heart. We know that COVID is being used as an excuse to privatise the NHS, and still they expect us to believe them and trust them when they tell us that they are prepared for COVID this winter. And so we sit and we wait. We wait for COVID and the death and destruction it will bring to our patients and their families, and to care homes and to our friends and colleagues. We wait for the inevitable toll this winter is going to take on our mental and physical health. We wait for the government to continue to gaslight us and the public. And we think about whether the NHS, the best thing this country has ever created, is ready for winter. I hope so, I really do. But the truth is, I don't think it is. Thank you.
Thank you so much, Karen. I mean, yeah, that's exactly what I've been hearing from other people and what we've been hearing across the board. And it's quite devastating to hear that things are still similarly, you know, we're similarly unprepared, and it just shouldn't be that way. I remember the first meeting that we did for NHS Staff Voices, and it was what's going on, you know, stories from the front line. And a lot of the stories were the shambolic situation that teams were finding themselves in. You know, they're just not enough PPE, young people having to leave their homes and stay far away from their families, you know, no testing available, just real horror stories. So we are therefore launching as NHS Staff Voices an action around this, because it seems to be difficult to get this across to the public, to the government. I don't know why the conversation is not moving forward. So we're launching an action to take place 1 month from now. So on the 20th of November, whether in hospitals, community services or outpatient units, we really want you to let us know and let the rest of the world know what the PPE situation is in your team. So if you can, take a picture of you and your team with the PPE that you have been provided. From what I understand, some teams are still working with 2 masks, for example, between 6 people. And I think that's not the worst situation that we're seeing. So either post your own photo, you know, if you can anonymize, then that's even better. If you don't want to, then that's fine as well. But if you don't want to post your own photo, then NHS Staff Voices will be providing graphics that you can then upload instead. So the idea is that on the 20th of November, all day, we want to see your photos or the graphics that we provide on social media, whether it's Facebook, whether it's Instagram, whether it's Twitter, wherever it is, you know, LinkedIn, in fact, anywhere. But we want to see these graphics, these pictures being put up with the hashtag, with the hashtags that we're going to provide. So please look out on the Facebook page, the NHS Staff Voices Facebook page, and we'll also be providing the information to our mailing list. So please don't forget to sign up to that as well. I'm going to put the link to our mailing list in the chat area. So now I'm going to move on. We're going to move on to our next guest. Our next guest is Elly Badcock, who is an occupational therapist working in the NHS and is also a member of NHS Staff Voices. Over to you, Elly.
Oh, thanks. Hello, everyone. It always feels really weird speaking on Zoom because, like, I can't see anyone, you know, any of the attendees, but it's nice to meet you all virtually anyway. So yeah, like Ali said, I'm an occupational therapist and I work in a learning disability team. And I also have personal experience with that because my little brother has a learning disability as well, and is autistic. So I'll talk a little bit, you know, from a professional standpoint, but also from, I guess, a personal standpoint of the effects that, you know, it's had on our family as well. So, I mean, just obviously generally to look at the kind of overall situation, I mean, the world is pretty much on fire. I don't know about anyone else, but I wake up every morning and look at the news on coronavirus and then I'm just like, no, I'm going back to bed. You know, so I don't want to spend too long dwelling on it, but I mean, the COVID death rates have been doubling over a week. Like, there's no doubt that this is a second wave, and the whole approach of the government the whole time can be summed up basically as putting profit before people. You know, it seems unbelievable that we had a summer where, like, the Chancellor of the Exchequer was basically bribing us to go out for cheap meals and put ourselves at risk with hundreds of strangers. And now they're like, oh, I wonder why the R rate is increasing. Like, you know, they could have given that money to furlough restaurant staff and pub staff and keep them at home and keep people safe. And they chose not to because they prioritise the economy. So, you know, let's not forget that, like, we've been put in real danger because people think that our lives are less important than making money. And, you know, when we started the pandemic, I think that people have short memories sometimes. Like, we literally were working with no PPE, the scientific advice was being ignored, there was all the warning signs, and they didn't listen, and they're still not listening now. I mean, you know, SAGE and other scientific experts have been calling for the circuit breaker lockdown. Wales have already implemented it. And, you know, and you feel if the government really cared, that's what they'd be doing. And instead, they seem to be fighting to keep pubs open. You know, and they'll make this argument sometimes, you know, government figures, and say, well, it's important for people's mental health and for, you know, that they get to socialise. And it just seems so two-faced. I mean, you know, when has the government ever cared about mental health services? They've been chronically underfunded for years. But apparently going to the pub is, you know, the only way that people have to, you know, to keep their mental health together. And, you know, it is, yeah, it's depressing, really. But I think we need to kind of turn that depression into anger somehow and into being active. You know, and it's a difficult time to be in the NHS because a lot of the stuff you see on the news, you know, it's all about, oh, we don't want to overwhelm the NHS. And, you know, this is obviously important, but it doesn't really begin to cover, like, the plethora of issues that we face in the NHS. I mean, everyone knows that obviously people are attending A&E less for other ailments that they have, you know, appointments, surgeries are being rescheduled, and, you know, in community teams in mental health in particular, like the waiting times just increased and increased, and people can't build the therapeutic relationship that they need to. And I mean, like, in my own experience, because it's not just limited to health, there's a social care problem as well. But I haven't seen my brother in 7 months, because the care homes have basically been left to figure out what the guidance is. Like, the government just haven't bothered to, you know, give in-depth guidance to care homes and people with learning disabilities. And, you know, that's without even thinking about the fact that, like, thousands of people have been sent "do not resuscitate" letters out to their homes, basically saying your life is not as valuable as someone without a disability, and if you get COVID, you should be prepared to die, you know. It just kind of shows us what the government really think of vulnerable people, because disabled people are just left out of the equation entirely. And I mean, in my professional kind of experience, you know, we're seeing a lot of referrals at the moment for so-called challenging behaviour, right? You know, people kind of acting out, and placement breakdown, you know, where they're kind of not getting on with the staff at their home. You know, mental health admissions are rising. You know, this uncertainty over what is actually supposed to be happening, that's coming from staff and health professionals, as well as, you know, individual patients. It's really, really hard. I mean, as an occupational therapist, like, there's been a massive increase in the amount of referrals that I've got that are about meaningful activity at home, because a lot of people are living in care homes where staff were already underpaid and undertrained and didn't know how to keep people occupied. But the day centres are closing down. You know, there's just no word on when day centres will reopen, and staff just aren't able to keep people occupied 24 hours a day. You know, and I'm not saying that day centres should reopen, but I guess what I am saying is, if the entirety of the government seems to be focused on, like, getting us to go to the pub, you'd think that they might have considered, like, other things that people spend their time doing and that vulnerable people need to access. But the fact is, yeah, it's not even that there's poor guidance for these communities. It just doesn't exist. We just haven't been thought about. I mean, you know, I remember some care homes trying to get tests for people, coronavirus tests, and they couldn't get it because you put your CQC number in and it said, oh, this care home has no one over 65, so you don't need a test. And we're like, okay, because, you know, disabled people under 65 just don't exist, you know. It really is awful. And, you know, this is obviously in the context of coming up to a huge winter crisis in the NHS, that's already deemed a humanitarian issue by the Red Cross. We've got limited flu jabs, you know, and we have people dying on trolleys every year during this winter crisis. The NHS, you know, isn't just in danger of being overwhelmed this year, it's been overwhelmed consistently, you know, every winter for years. The waiting lists for mental health services are completely obscene. You know, despite staff's best efforts, people die when they don't need to. We in the NHS we've never been paid enough for the work we do, and we've always been taught that somehow, you know, talking about this is somehow unseemly, you know, because we should be doing our job because we're altruistic and because we care about people. But how is it possible for us to provide the best care when, you know, you have nurses using food banks? Yeah, and I mean, you know, we are at the point now where I think that healthcare staff have to be prepared to, you know, take serious action to not only defend sort of the few gains that we've won in the health service over the years, but actually to ask for a lot more. You know, like Karen was saying about this snack box, like, we don't need a snack box. We don't need people clapping for us, although it was very kind when people did. You know, we need a pay rise so that we can care for ourselves and care for our patients. And I think we need to be ready to campaign in every way we can, and indeed to strike for that if it's necessary. Thank you.
Thank you so much, Elly. It was really good to hear from you as well. It's really good to hear from people on the front line. It really is, you know, so important to hear what is actually going on in our NHS, particularly when there is so much misinformation about that. Please do add your questions, guys. We don't have any questions at the moment. And also, we're not live on Facebook, unfortunately. So we are relying on our attendees in the Zoom meeting for our questions. We will put it out, put the meeting out on Zoom. It's just not streaming live at the moment. So sorry about that. So we'll go next to Helen O'Connor. Helen is an ex-nurse, NHS nurse, and is a union organiser in the NHS. So glad to have you on, Helen. Over to you.
Thanks very much for inviting me, Alia. So the two things that are destroying the NHS from the inside basically are cuts and privatisation. And this assault on the NHS and on free healthcare at the point of need has been going on since I first started working in the NHS as a student nurse back in 1990. And long before we had a pandemic in this country, this was happening. I remember way back in the 90s when I was working in the Whittington Hospital A&E department as a staff nurse, St. Bart's lost its A&E. And when I worked in A&E, I rarely saw any patient abusing the system. In those days, every patient who came through the door of the A&E was triaged by an experienced nurse, put into the right bit of the department, and an effort was made to diagnose them properly. They were cared for, treated, and admitted into beds if they genuinely needed to be. And over several decades in this country, there has been a reduction in the quantity of medical interventions available to the public free on the NHS. The number of the NHS beds have been reduced per head of the population, and there's been a decline in standards like hospital cleaning, for instance, which has been caused by outsourcing to private companies, and it's led to the rise in hospital-acquired infections. And overall, NHS services, I think staff are used to having them being restructured, the services are being merged, they're being reduced, and they're being moved further away from people, which means patients have to wait longer for treatment, they have to travel further, and we need to be very clear that medical conditions actually worsen, they get more complicated, more difficult, and more expensive to treat when there's delays in patients getting treated. And for decades, right-wing government ministers who are ideologically opposed to the NHS and public services have been working hard to develop strategies to reduce the accessibility of free NHS services to the public. And one of the ways they do this is by restricting the access points, which are A&E and GP services. And we have an entire generation of senior NHS managers who lack clinical experience running the NHS. And they're there purely to enforce the cuts and privatisation agenda. And we need to be clear that this is continuing at pace, even during COVID-19, because decisions around closures and privatisation are still being made without due process and scrutiny, and these changes will be embedded further during this crisis. And private companies are being drafted in to cash in on this crisis. And at the best of times, the current crop of NHS leaders have no clear understanding of patient needs, and they've no experience of what it's like to work on the front line, and their sole focus is to preside over carving up and selling off NHS services, NHS land and NHS buildings. And there's an overuse of financial models to plan NHS services that are not based on patient need. And during the first peak of this coronavirus pandemic, the lack of preparedness of the NHS to deal with the virus was simply staggering to me. We all knew the virus was coming, but a business as usual attitude prevailed in the NHS. And now the virus is on the upswing again, and we're seeing exactly the same difficulties with the provision of quality PPE and the problems with health and safety that we had before several months ago. And the private companies that already operate in the NHS have further eroded NHS workers' pay and conditions. And we will all pay the price for this during the pandemic, because the deliberate withholding of contractual sick pay in particular is a cross-infection risk in our hospitals at the best of times. And outsourced workers end up on very low levels of statutory sick pay, which forces them to go into work in a hospital when they're carrying infection. And during the last peak of the virus, I had reports from my outsourced worker GMB members that they were denied access to COVID testing. They couldn't get a test, so they couldn't get permission to isolate, and they had to come into work when they had clear symptoms of COVID-19. And trade unions had a contract by contract battle to get these big NHS facilities management companies to offer wages if workers needed to isolate with COVID-19 symptoms. And many didn't even agree to this most basic safety demand, even at the height of the pandemic. And NHS staff already have experienced decades of the impacts of cuts and privatisation on themselves and the patients. There's been a colossal and crushing growth in bureaucracy and form filling that is utterly demoralising clinical staff and taking them away from patients. And there's been a relentless drive to push down the pay, terms and conditions of NHS staff, which is making the NHS, which is the largest employer in this country, an increasingly unattractive place to work. And there's a drain of highly skilled and experienced staff out of the NHS, which is actually putting patients at risk. And demoralising NHS staff and holding down the wage bill is yet another way of destabilising the NHS, because the NHS is nothing without its staff, and we need to be really clear about that. NHS workers, including nurses and yourselves, have worked to save many lives during the peak of this virus. And it was in spite of government policy and not because of it that you did that. And it's simply staggering and wrong on every level that this government has made a clear decision to bypass NHS workers in the recent public sector announcement on pay, following these efforts, these huge efforts that people have made during the pandemic. And staff are going into our hospitals to face a second peak of this virus, knowing that this government does not value them. I'm hearing that people are exhausted, they're stressed out, they're demoralised, they're frightened, they're concerned about themselves and their patients. And often NHS staff do put their own health and well-being actually before the patient's health and well-being, rather, before their own health and well-being. And I think it's under these conditions that NHS staff are becoming increasingly politicised, and they've raised their just demand for the 15% pay rise. And why demand 15% pay rise? The answer is clear. It's because NHS staff have lost so much during the previous decade of austerity in this country. And normally, if you've years of experience in any job, you do see a pay increase, but not if you work in the NHS. If you work in the NHS, the more experience you get, the more your pay, terms and conditions will plummet, and that's just simply wrong. And we have a health service that's been severely compromised from decades of this sort of behaviour. We've less experienced staff, less beds, and we're now entering an upswing in the virus. And that's the backdrop to this second swing of the pandemic. And we've also seen growing poverty and health inequalities rising up in this country. And that's going to put even further strain and more demand on the NHS. And we need to be clear that this government is failing in its COVID-19 strategy, and we're heading towards a catastrophic situation in terms of the health of the nation and the economic stability of this country as a whole, because the partial lockdowns are not working to contain this virus. And in fact, infections are on the rise in the areas that have been subjected to the partial lockdowns. The test, track and trace is failing when testing should now be very well established as a key part of the strategy to contain this virus. And the ability of working class people to keep themselves safe and healthy is being rocked to the core by the scrapping of the job furlough scheme. A jobs cull is on the horizon, as small businesses are being left to go to the wall and big companies are being given a free hand to cut costs and erode jobs, pay, terms and conditions even further. And to add insult to injury, 12 billion of public money has been poured into the coffers of private companies for this testing system that is failing the mass of the population. But sufficient cash flow is being denied to bail out small businesses and ordinary people to enable them to survive the worst impacts of this virus. And this devious government strategy of pitting public health and the economy against each other is shocking, because we are the fifth richest country in the world, and there is money in this country to protect human health and livelihoods against the worst effects of this pandemic. So now we're in a pressing and urgent situation with a government ignoring public health guidance recommended by scientists, which should be of concern to anybody. Our NHS is being stripped to the bone, even as this pandemic rages on, and we are going around the deadly COVID-19 virus loop once again. NHS staff are struggling, they're at breaking point, and ordinary working people are being forced to pick up the full bill for dealing with this coronavirus, as their jobs and their health is being sacrificed by a penny-pinching government hell-bent on funneling billions into private companies. So while working people are doing their bit to understand and stick to complex rules, and they're delivering the services in the shops, the hospitals, the communities, it's increasingly clear that they're all being failed by this government at all levels. We must be clear that there is absolutely nothing that is working well or okay about the government's handling of this pandemic. And this Tory government is now peddling the false narrative that local partial lockdowns are necessary and that working class communities have to suffer unprecedented levels of poverty and hardship in order to prevent a national lockdown. And this virus has shown the sharpest picture of just how dysfunctional our society is, and the corrupt manner in which it's being run is being exposed. So we need to find ways to come together and concentrate our minds on what we can do in this period to build resistance to what this Tory government is doing to us. So NHS nurses and health workers are at the forefront of this struggle, and everybody needs to get behind NHS workers in their just demand for a 15% pay rise, because it's not just a demand for fair pay, actually, it's a fight to protect standards in the NHS for future generations. And there's a real and pressing need for all concerned campaigners, community groups and trade unions to unite together, and we must get serious about organising in our workplaces, in our communities, and we must encourage NHS staff to make sure they join their unions and that they're fully supported to be active in their trade unions, and we must be open, honest and blunt about the scale of the devastation that's potentially facing this country, and we must come up with a clear set of demands that protect human health in this period and formulate the type of demands that will stop working people plunging even deeper into poverty and destitution, because there is money in society for a fully funded people's bailout and to rebuild the type of public services that we all need and we all deserve. Doing nothing is simply not an option, and if the very real prospect of rising disability, death, poverty and destitution is not the wake-up call we all need to unite together and act to oppose this Tory government, I don't know what is. Thanks very much.
Thank you so much for that, Helen. That was an incredibly powerful and polemic contribution, as were all the contributions we've had this evening. Yeah, I just want to add my own kind of astonishment to the whole snack box suggestion that, you know, NHS workers can have a snack box and a badge, you know, whilst MPs are awarded a pay rise. Once again, I can't even remember how many pay rises they've been awarded in the past 10 years when, you know, we have been seeing, and I've also worked in the NHS for about 10 years and have witnessed firsthand the real systematic breaking down of the NHS, particularly after the Health and Social Care Act, where it was written into the bill, you know, that parts of the NHS were to be sold off, privatised. It was part of that condition, really. You know, we started this crisis with a broken infrastructure, really and truly, you know, despite the findings of pandemic planning in 2017, the government ignored the fact that there was inadequate PPE, the intensive care capacity was also inadequate. You know, there was a creation of over 100,000 vacancies, 40,000 vacancies in nursing. And I just want to also add something I heard on Question Time recently. You know, private companies and Friends of Conservative MPs are being awarded week-long contracts. And in that week-long contract, they're being paid, Helen will have heard this already, you know, they're being paid a nurse's salary of a year. And it's so insulting. It's just so painful. I can't imagine, you know, the difficulties that people are struggling with at the moment in times of a global pandemic, and the government are just not taking any notice of that. And I think that's the perfect time to bring in our final speaker, who is Allyson Pollock, Professor of Public Health at Newcastle University and also a founding member of Keep Our NHS Public. So Allyson, over to you, and thank you for joining us.
Thank you very much, Alia, for inviting me tonight, and the impressive speakers we've had. I'm not going to speak too long because I think there might be questions. Are there, Alia, afterwards? So I'll try and not use up too much time.
We have a
and Alia's already summarised why are we in this mess and what can be done about it, really. I'm a founding member of Keep Our NHS Public because privatisation of our NHS has been going on for over 30 years. It began with competitive tendering, then we had the Private Finance Initiative, which we're still paying a lot of money for. And we had all these incremental changes which really resulted in what people in England don't realise, the abolition of our NHS and the removal of the duty on the Secretary of State to provide universal health care, and the gradual erosion and evisceration of services, and also the fragmentation. So what happened when COVID struck was not only were we not prepared for a communicable disease outbreak of this scale, but our services weren't prepared, and that was no small part because we just didn't have the capacity, the resource, and the staff. So while Elly's rightly talked about PPE, that's only a very small bit of the story in a way. So we weren't ready, and one of the reasons, I'm sure, when we come to look back, why we've had so many deaths, we're at 60,000 deaths now, both COVID and non-COVID, and why we've got so many excess deaths from COVID and non-COVID is because so many people didn't get care because they were actually dying at home or in their nursing homes without the care that they needed. It's already been referred to the fact that people were discharged from hospital, older people, to nursing homes with COVID, but also people didn't get care. And I think this is something that we're really going to have to understand. Now, the reason why they didn't get medical care was patients were told to stay at home and not contact their GPs. And GPs were also told to do Zoom calls and many of them didn't go into the nursing homes. And so you had in these nursing homes, residential care homes and at home, older people struggling, and the staff who are very low paid, and many with high vacancy rates, high sickness rates, struggling to cope with people who were very, very sick and inevitably were left to die because there just wasn't the care. There weren't the staff to give them the care and the support they needed. So I think one of the lessons we have to learn is that we're all vulnerable in a crisis, but some people are much more vulnerable than others, they're much more at risk. And they included the workers, especially social care workers and older people. And the government still has done nothing to fix the system. And from the start, what could have happened was a redeployment of staff into nursing homes and domiciliary care to create much smaller social bubbles, to stop agency staff going in, to improve terms and conditions and the training. Because not all of the NHS was busy at the time. Many people were redeployed onto the COVID wards and ICU, but many staff actually had nothing to do. And that was because things like elective surgery, community health services had stopped. And this was the ideal time to redeploy the staff and the medical students who were graduating early into nursing homes and the areas that really needed them. So we weren't ready, and that's in no small part because of the huge cuts, prioritisation and fragmentation. But the story is even worse because the government, instead of building up capacity where it was needed, focused on continuing the policy of privatisation. And perhaps it's the testing strategy that is the worst strategy of all. You'll all remember the WHO saying test, test, test. Well, we didn't have the testing, but testing is not very useful on its own. It's very unusual to be able to order tests without going through a health professional, and you certainly can't do it in the NHS. But the government actually took testing out of health services, as you know. You could only get it to begin with if you were a hospital admission, but when it began to put it back into the community, it did so without integrating it into primary care. And so GPs were not allowed to order tests, and patients then did on-demand testing. And that has led to a lot of confusion and a lot of misunderstanding about what a case and a test actually means. And I can go into that in more detail if you want. But I think the message from today is that a positive test can mean that you're infected, but it may not mean you're infectious. It can mean that you're infectious and infected, or it may simply mean that you've got the debris of an old virus and you're no longer infected or infectious. So interpreting a test is very difficult, and it should be done with a healthcare professional and in conjunction with the symptoms. So of course, the more you test, the more positive tests you get, and it's very, very difficult to interpret what this huge rise in cases mean when it's only about positive tests and when we're testing 300,000 people a day. And we've privatised the testing, and we've taken it out of NHS labs, we've commercialised it to the tune of billions of pounds. And of course, the other thing that we did was we privatised contact tracing. So Serco and Cital have over £1 billion worth of contracts, and we know that that's been hugely ineffective. And we're in a mess because we didn't get the basics right. We should have been focusing on people with symptoms, on having them tested and diagnosed and supported, and then doing the contact tracing. But as it is, we have a system that's now overwhelmed because we have lots of positives, but we don't know whether they're infectious or infected or transmitting, because as well as people who are real cases and symptomatic, we've got lots of people who may not be infected and may certainly not be infectious. And that will then lead to a huge strain on the contact tracing system, which isn't working anyway, because we know that the private part is ineffective. And then what then happens is that contact tracing can't cope, and the government then begins to trigger lockdowns on the back of cases. Now, there's no doubt that cases are rising and that admissions are increasing and ICU admissions are increasing, but the thresholds for admission are very different from March and April. They're very much lower, because if you remember, most people who died of COVID in nursing homes and older people in home were dying in the community on their own and not getting into hospital. That situation has changed now. And of course, this is a disease which affects older people. So Andy Brenham is absolutely correct to challenge the government on its statistics and data and what it means, and to also challenge the notion of national lockdowns, when really, if contact tracing was working, we should be doing regional and local measures and restrictions. We shouldn't be needing to move into centralised national restrictions, especially when many parts of the country do not have the same rise in cases, especially around London. So we've got a mess here, a mess that's made of a testing strategy which was really not built on public health grounds, but it was being built on developing a diagnostics industry. And you will all have heard about Operation Moonshot, where the government plans to expand testing to the tune of £100 billion. That's 70% of the NHS budget. £100 billion on tests which have not been shown to be effective or work or purposeful. So this is really very worrying. So if there's any message that I want you to take home, is think much more critically about tests, about testing and what cases really mean, and really think about what the data says. We've heard a lot of issues tonight, but there is no way you're going to get your health services back. There's no way you're going to get national terms and conditions and decent paying conditions until you get your National Health Service back, which is why after 2012, a group of us worked so hard on an NHS reinstatement bill to reinstate the NHS and to get legislation into Parliament. That bill has fallen away. It needs people to mobilise around it, but as well as having reinstating the NHS as a National Health Service, publicly funded and publicly owned, we urgently need to do something about social care, which has been shockingly privatised and where companies have made hundreds of millions of pounds out of taxpayers' funds. So something urgent needs to be done, and we need to have the vision to think about going forward next year. COVID could have presented an opportunity for rebuilding, reinvesting in public services. This has not happened, and it will not happen until the public start to say what it is they want, and that they don't accept that things are not affordable, and they do not accept the continual hollowing out and privatisation of our NHS, which is going on in a daily basis, where there are really big legal questions, where there is clear corruption going on for many of these contracts that are being awarded to companies which have no record and no reputation in delivering the sorts of services that the NHS has done. And I include test and trace, PPE, many ventilators. So many hundreds of millions of pounds have been squandered because we haven't been careful with, our government hasn't been careful with the money. So the message going forward is to really understand what's happening to your health services, the way they're being eviscerated and hollowed out, the same with local government, which has had no real role in this pandemic, and also social care. And there's no point fighting for staff terms and conditions if you're not actually fighting to rebuild and reinvest in health services and social care. You have to have a multi-pronged approach. It won't succeed otherwise. It'll just simply be more divide and rule. So I'll stop there, and thank you very much for listening.
Thank you so much for that, Alison. So I'm going to just go straight to questions now so that we can get them all in, because we have got quite a few. I'm going to put us on gallery view, if that's okay, so we can see everybody. And I'm just going to ask the question, so just unmute yourselves and feel free to join in wherever. We've got some questions for specific people, so I'll just make sure that I make that very clear. So our first question is from, who is that from? Sorry, from Steve Carney. How aware are staff of the infrastructures around them in their local areas, the local councils, clinical commissioning groups, trust boards, integrated care system boards, plus all the chaos of the GPs struggling with the primary care networks? Without bogging people down, I'm trying to think of targets to focus on locally. So that's a good question, and you know, I'll ask all our panelists to have a think as well to sort of let us know at the end any action points that you think would be useful. Yeah, so if anybody wants to come back on that question.
Do you want me to have a go?
Yes, please.
Yeah, well, I think the structures, the way they're set up, are extremely difficult for everybody to understand. You know, patients, staff, anybody, even if you're very interested in the NHS, it's very difficult to kind of get your head around all the different bodies and groups. And there is a need for us to get our heads around that. And I think some of the strategies that we might be able to kind of employ kind of in the future is kind of lobbying some of these bodies, particularly the CCGs, emailing the MPs as well, and the councillors, and just putting real pressure on, particularly around what's going on in the NHS in the present period, with health and safety, with the provision of PPE. I mean, this is going to be our day of action, isn't it, on the 20th of November? We want an update from all the NHS staff throughout the country, you know, what's happening with PPE. But I know it's going to be a problem already, and I know that health and safety is a massive problem simply because the health and safety executive has been slashed to the bone for years, so they can't legally enforce the law in this country. So I know there's going to be huge problems going forward, but I think there's a real opportunity for us to kind of really kind of strategically kind of come together. At CCG is a clinical commissioning group, so they're responsible for all the commissioning. So yeah, so there's a real potential for us to kind of put the pressure on kind of collectively across the trade unions and across the community campaigns and with the NHS staff, and just try and put a bit of pressure on them, particularly as problems start to rise up now with the second upswing of this pandemic.
Thank you, Helen. So just to reiterate, lobbying the CCGs, which are the clinical commissioning groups, who are basically in charge of the money, you know, and lobbying MPs to let them know what we know, and to put pressure on them to sort of do the right thing, essentially. A question for Elly Badcock. Elly, is it still the case that disabled people and those with learning disabilities can still not get tested if they are under 65? I had thought that anyone with symptoms could get tested, but perhaps I'm out of date. I don't know if you can answer that, Elly, but that is a question for you.
Yeah, no. So they can get tested now. What I was referring to was happening back in the first wave. But I think, you know, I brought it up because it's so symptomatic of just these people's needs not being considered at all. You know, we're in a situation where, like, yeah, a lot of these people are clinically vulnerable and also socially vulnerable as well, and would find it hard to adhere to lockdown, find it harder to do things like wear a mask or other kind of preventative measures. You know, so they're at risk, and they're potentially, you know, putting other people in like group homes that they live with at risk as well. And, you know, to just, I guess, not have their needs considered at all, you know, for something like that to slip through the net, it just, yeah, it was very galling, and just makes you think, wow, like these people are really at the bottom of the pile when it comes to, you know, being cared about by by central government. Like, yeah. So yeah, but don't know, anyone can get a test now if they have symptoms.
Thank you, Elly. Yeah, and you know, you did highlight some really shocking things when we heard from you earlier, and that is one of the more shocking mishaps that we've seen. You know, how can they just be so foolish, really, as to think that there's a certain age, you know, for a disability? It's so ignorant and so insulting and upsetting, and it has left so many people, so many families in really terrible situations. And we've got a question from John Puntis. As is widely acknowledged within the NHS, it is essential for infection control purposes that workers within the NHS premises experience no financial pressure to attend work when they should be isolating following public health advice. Is your trust fully compliant with the instructions issued by NHS England and NHS Improvement on 2nd March 2020, and those guidelines are to ensure that any member of staff, including bank staff and subcontractors, who has to be physically present at an NHS facility to carry out their duties, receives full pay for any period in which they are required to self-isolate, and as a result of public health advice. So I guess that question is for Karen and Elly, but Helen, you'll probably have some information about this as well. So whoever wants to sort of pitch in on that one, please do.
I have to say, based on my experience, our trust is providing full pay, including enhancements to staff that are isolating. I can't confirm about bank staff and subcontractors. So.
Yeah, same here. I mean, the people that are employed directly by the trust and the bank staff, that does seem to be the case. But I guess the difficulty comes in when you've got, you know, all of the cleaners and domestic staff are outsourced to like ISS and, you know, these sorts of things. And you know, no one really seems to know what's going on with their working practices. You know, and as a union rep, I've been trying to you know, reach out to people that are working for different contractors in the NHS in the same sites and say, you know, why don't you join the union? And actually that can be very difficult because people who are working for these private contractors are much more likely to be very scared of the word union and to think that, you know, that will lead to them being dismissed. Whereas NHS staff, you know, there's a recognition agreement in place, you know, and then they're much more familiar and comfortable with the concept of unions. But yeah, I guess I'm deviating from the point a bit, but I think that, you know, looking at those subcontracts is really crucial in any sort of action that we do.
Yeah, and just before Helen does fill us in, I just wanted to read a comment that's really connected to that from, I think it's from Nigel Frost. It says, if those cleaners don't turn up for work, their families don't get fed. We must bring the NHS back into public ownership with all on regular contracts, enabling access to sick pay and benefits, not for private profit. Thank you.
Okay, so just on the testing issue, I mean, testing is really difficult for the outsourced workers to get any form of testing. And I've come across a case recently where a worker had symptoms and he didn't get testing. I've come across people, particularly outsourced workers, who've been forced to come in with clear COVID symptoms actually, and be around vulnerable people like elderly people in the patient transport services, which are all outsourced as well. So there is a real difficulty there with testing and with health and safety and with zoning of some of the hospitals actually, because about a week ago we had a situation where there was 3 coronavirus patients in a South London hospital, which is one of the hospitals I organise, and they were just dotted around the hospital. They weren't isolated. So that will give you some idea of just the kind of lack of kind of the breakdown in kind of processes and health and safety and infection control procedures right there. In terms of, I mean, I'm always interested when people bring up the points about unions. So thank you, Elly, for raising about the trade unions. I appreciate that. And I will say that my own experience of organising in the NHS, you can actually organise NHS workers without a recognition agreement. And we've had a lot of success actually in the GMB union, organising people against ISS, against Mighty. We went into dispute with a private company called Mighty in St George's Hospital in 2019, I think it was now, where they were trying to cut hours from staff. They were trying to cut the cleaning in a hospital. So everybody sort of joined the union and fought hard against that. And sometimes I think personally that the outsourced workers are so oppressed, they're so underpaid, they're bullied, they're more ready actually to join a trade union because they're at a point where they just want to fight. And I wish, you know, I think nurses and others are starting to get to that level now because they've been through the first peak of the pandemic. But I'd say definitely the key thing that any NHS worker, whether they're insourced, whether they're outsourced, must join a trade union, not just join a trade union, but get active in one. And then the key task of the unions and the community campaigns is to all link up together so we can all pack a much more powerful punch against this government, because everybody's at risk from what this government's trying to do to us at the moment. So we need to use every method. It's not going to be a case of one or the other. We need to use every weapon at our disposal basically to hit back at them. So I'll just leave that there.
Thank you, Helen. So we've got a question, and I'm going to ask the question and then read a comment and then come back to you all if that's okay. The question is, we have a lot that needs to change, so how can we effectively seek change? It's a big question, so I'm going to come in with a comment before I ask for any answers really. That question was from Barbara D, and this is from Stephen again. Bypassing and avoiding anything seen as public service NHS is now a very obvious pattern. It has happened with PHE too, so Public Health England too. The darker agenda is not focusing on building up the public service expertise and instead concentrating on developing a parallel service based on profit-seeking companies. What sounds great, integrated care, is actually a falsehood. Merging, centralising is all spun as improvement, but in reality is all about familiar cuts. But trouble is doctorpreneurs, local authority councillors, and buying the spin and delivering the cuts as efficiency savings. How strong is the bullying culture in the NHS, and is it still a problem for staff to speak out? So that is actually a question as well, I didn't realise. But that question and the other one, which is we have a lot that needs to change, so how can we effectively seek that change? I'm going to open both of those questions out to our panel, please.
I would agree with the assessment. It is a falsehood. There is no integration, and we see that on a daily basis on our ward. As regards the bullying culture, yeah, still there. And coming back to Barbara's question, how we effectively seek change, we need to start working from the bottom. We need to start motivating and mobilising the staff. That's the only way to do it, because nobody at the top is listening. It needs to come from the bottom and rise up. I can't see any other way of doing it.
Yeah, and I suppose joining campaigns like Keep Our NHS Public, joining networks like NHS Staff Voices, joining the pay campaign, getting behind the pay demand, you know, joining a union, all of these things really will hopefully add to the fight and add strength to the fight. And talking about it openly, you know, getting involved any way you can, really. And the thing is, I think in a slightly more optimistic vein, people are really coming to understand what's going on, and a lot has been hidden from us for a long time as the general public, and this crisis has made it very difficult, in my opinion, to keep these things hidden, these lies, these ways of, yeah, you know, profit before people, basically. That's the mantra that we've had ruling over us for so long, and that is now becoming more and more obvious. So just getting into any of these campaigns, I think, is really, really important. But sorry, that wasn't for me, that was for everyone else.
I mean, I think as well, things are changing really rapidly in this period, actually. And when I worked in the NHS, I mean, I was in the NHS for 28 years. I've never seen anything like what's happening now in terms of people just coming into activity, and nurses and frontline workers in particular. You know, suddenly they're stepping up to like organise demonstrations in the street over NHS Pay 15. And look at the impact of that campaign. It's been absolutely staggering. You know, the campaign has pushed 2 major trade unions in this country, including my own union, GMB, to back this campaign nationally. I mean, what an achievement already. And you've only just started. You know, so I think there's a lot more that can be done. I think consciousness of NHS staff is rising. I think nurses and health workers in the front line are suddenly recognising their own value, actually. And they're starting to think, hang on a minute, you know, the country is resting on us. Everybody's relying on us to get them through this pandemic. We've got the expertise. We're not being rewarded for it. And, you know, that people are starting to kind of, you know, just recognise their own value, which I think is really, really important as well. And I think we're in a difficult period, but also it's a period where we can build. And I think you guys, you know, the frontline staff really are the future of the NHS in this country, and the future of kind of like protecting the NHS. And like I said before, this campaign for pay, I just want everyone to get behind it, because it is about stopping standards slipping down within the NHS, and the demands for outsourced workers to be back in under the NHS and under NHS pay terms and conditions is such an important strategy to like stop the further erosion of the NHS and to push out the private providers, actually, because they're not going to be interested if the contract's expensive to run, you know. So I think it's a key part of the strategy, actually, making big demands around pay terms and conditions, including full sick pay and pay that people can live on. I think it's a very, very important part of this, the fight to protect the NHS.
I was just going to come in as well and say, you know, I think people have covered kind of broadly what we can do. But I mean, each of us has some kind of role to play in this. And, you know, I think often when you look back at like big struggles in history, you know, it can kind of seem like, oh, well, you know, this movement just happened. And, you know, that's not kind of how these things work. You know, it really is the small actions that each one of us take, right? You know, so you might be in a situation where, you know, you don't yet feel confident to you know, just kind of march onto a picket line and give like a barnstorming speech, and that's fine. But, you know, having that, I guess just that kind of that drive to change things and to realise that you can make a difference in the world is really important. I mean, you know, NHS Staff Voices do a newsletter, right, with reports from the front line, from NHS staff. Like, start by taking that into your canteen or whatever, putting it in the nurses' room, and just getting people talking about the fact that, like, actually they are entitled to better, and that, you know, we can create a better NHS to start with, maybe even a better society if we work together on that. So, you know, I guess if there's, you know, one thing that people would take away from it, it's just that you can change things. You can have a hand in changing the world, and the things that you do aren't insignificant. So believe that by yourself.
Thank you, Elly. That was really quite lovely, actually, and really important to remind us all that, yeah, the things that we do, the little things that we all do, are not insignificant. In fact, you know, these campaigns wouldn't really exist without the little things that go on. Thank you for reminding us of the newsletter as well. So NHS Staff Voices have put out our second edition of our newsletter. If you would like to submit any stories from your places of work, then please do. I'll put the email address into the chat, and I'll also put the newsletter, a link to the newsletter in the chat, so please do check it out, and please do like the Facebook page. I'll also add the link to that, and sign up to the mailing list, and all of the information for our future meetings, our newsletter, and the actions that we have going on in and around our campaign, you know, also what goes on in other campaigns. So for example, the Day of Action on Saturday, which is really, really important, against the US trade deal. I will give the full details for that at the end of the meeting, so please do look out for those. So yes, does anybody else want to come back, or shall I go to the next question? Next question. So we've got so many comments, so I'm not going to be able to read all the comments. There's lots of comments saying thank you to our panelists. You know, you spoke really well. People tend to underestimate people's ability. This is from Floyd Codlin. People tend to underestimate people's ability to organise, as we've seen in the COVID support groups. However, do the panel think that a socially distanced mass protest should be organised for next year that demands that various issues are addressed? I'll bring another question in as well, just because we've got quite a few little ones. If I can find the one I was looking for. Well, I mean, let's come back on that one. What do people think about a mass protest at some point next year?
I mean, do you want me to come in on that? Because I've been doing a lot of thinking about that in the present period, because obviously my day job is to like organize people and have demos and have protests and all the rest of it. So it's a question that's high in people's minds, I think, because at the end of the day, we're in a period where, you know, we're under, you know, fierce assault from the Tory government, actually. We do need to think carefully about how we can come together to put the pressure on. Prior to this rule of 6, you know, we did manage to work out some ways to have protests and do them safely. And we're trying to think about guidelines all the time to make sure the social distancing, mask wearing, hand sanitizer. So we have achieved that before. And I think we're in a period now where we just need to assess the situation very carefully. And it will be governed by hospital admissions, by you know, the figures of people, you know, who are in hospital, the deaths, etc. And we will need to decide, you know, when it is okay for us all to go back out in the streets again and do that. But it requires a careful assessment and discussion, but we can't afford as a movement to lose our confidence, you know, and whether we're on the streets or whether we're online, we'll find methods and ways around this to organise people. I do feel confident that we will. So I'll just leave that there, but a very good, interesting question there from Floyd, who I know well.
I wonder, I mean, I'll leave it to like my colleagues in sort of public health and with a more medical background to say when it's safe to go out. Do you know what I mean? I'll take their lead on that. But, you know, I guess one of the things that is concerning is that obviously the protests that are happening are all these kind of anti-lockdown protests, and, you know, these kind of protests saying, I'm not going to take the COVID vaccine, it will cause autism. And, you know, if that's the only sort of street mobilisation that's happening, that, you know, that obviously is concerning. But, you know, I think like Helen says, it's about, yeah, being careful, looking after ourselves, not contributing to a pandemic when we're trying to, you know, challenge the government's handling of it. But, you know, I hope that when this is over, people will be incredibly angry and that the protest movement will grow and grow and grow, because people will realise how betrayed they've been by a government that, you know, to all intents and purposes is supposed to care for them and has shown its true colours. So let's try and keep the anger going until it's safe. Yeah.
I think one of my concerns about this is bearing in mind all the actions the government has taken recently to try and crack down on
Yeah, Karen, I mean, you know, I hear what you're saying. You're absolutely right. I think there is a kind of a bit of a crackdown on things at the moment. But I suppose I always think back to history and when trade unions were first set up, and there was no like law or anything then, because people just came together, didn't they? I think about when my own trade union was set up, you know, and then the law and the kind of controls on the trade union movement and kind of the fight back came sort of after that. So I suppose we always need to keep that in the back of our minds, you know, kind of, you know, they can't take that much away from us, really. Do you know what I mean? Is we have to, you know, we do things in a careful, considered way, you know, but there will be a need, I think, for everyone to come together and just challenge this government in every way we can and using every method we can. And I understand that people are worried in this period. I get that, you know, we're all worried in this period, you know, about kind of how we come together and organise. But I think it's a changing situation the whole time, and I think we just need to assess it properly and carefully. And nothing's fixed or nothing's certain in this period, and we just need to make sure we assess things correctly at the right time.
Yeah, I just want to agree with Helen on that as well, that we have to make our presence known when it gets to that point that we have to get on the streets. Then we will have to do the risk assessments, and we will have to do that because, you know, as you said, Karen, the government are doing some sneaky things and they are making things more difficult for the general public, but that's something that we just can't really stand for, because it makes things very dangerous for us, even more dangerous than it already is. So I'm just going to move on to another question. On the issue of consciousness of NHS staff, time-honoured, or rather time-dishonoured processes of divide and rule have for long created and reinforced a staff society functioning dissonantly so that big private providers can slip into the cracks of the system. Therefore, as a counterfoil, unity of our approach must be, I'm reading this badly, sorry. Unity of our approach must be the critically responsive resolution. So I suppose that's not a question I was duped into thinking it was. Thank you, Stephen Barak, for that. Another question, doesn't the withholding of contractual sick pay mean that no different to any other line of work where employees need money just to get by? NHS staff are being encouraged to look after people who are unwell when they're also unwell themselves, which can only exponentially compound the COVID contagion within hospitals as well as within the larger community. Again, not a question, so sorry about that. We've got some really interesting conversation going on actually in the chat. I'm not going to read it all. A lot of staff are too busy and fatigued to take action, and also are afraid of taking action for fear of the response of their employer. Again, a comment, but unions need to be reassuring them about their rights and union protection, and lots of support for that comment. So thank you all. We've got lots of comments, but it looks like no more questions. So I'm going to read out a couple more, and then I'm going to come back to our panel. If you guys can sum up and maybe just think about offering anything that you think people can do to, so going back to that first question, how can people support NHS staff? How can people support the various campaigns and the various things that sort of need support? I mean, I will remind everybody about the PPE action on November 20th, so that's exactly a month from now, and the day of action for the trade deal on Saturday. So another comment, just quickly, people should contact their councillors and public health directors to force government to begin to get track and trace being done at a local level. That's a really important comment from Pam Remen. We've got a couple more. We've got a couple more questions. So if the panel are okay, I might just feed them through as well. Valerie Griffiths said, are there ways of bypassing the goods and services provided by outsourcing? For instance, using reusable masks and PPE and encouraging people to avoid testing unless absolutely necessary. Another question, how do local campaigns engage with staff where no staff action seems to be prominent? So I don't know if anybody wants to come back to either of those. Elly?
Go on, Helen, you go first.
Okay. In terms of the question about outsourcing in private companies, I think the demand to bring all services back into the public sector is really, really key. That's the demand we need to make around that, plain and simple. And sorry, I can't remember, there was another question, wasn't there, as well? I can't remember what it was.
Another question. How do local campaigns engage with staff when no staff action seems to be prominent?
Well, there is staff action actually. It's the NHS Pay 15 campaign. So I would say I think we need to link up that campaign really clearly with Keep Our NHS Public, with all the other really good local NHS community campaigns out there. And I think, you know, the one thing that gives NHS workers, in my experience from organising the outsourced workers, real confidence actually is when the community turn up to support them. And that happened when we were taking on ISS in Lewisham Hospital actually last year. And when the community and, you know, the Keep Our NHS Public turned up at their protest, and they were it really did bolster them up actually. So I think it's really, really powerful. So so we absolutely need to all get behind this just demand for a 15% pay rise and support the action on the 20th as well around the PP and stuff, because it is going to be a bit an issue with COVID on the upswing. Health and safety and provision of PPE are going to be so key now going forward.
Elly, I think you were going to come in as well.
Yeah, so I think on the kind of practical question of engaging with staff, if they're in a trust where there doesn't seem to be much kind of action, just find your nearest hospital and figure out what the shift change time is. So I think for nursing staff in hospitals, normally about 7:30 in the morning and 7:30 in the evening. You know, go there with stack of like the newsletters, the NHS Staff Voices produce, or whatever kind of campaigning materials you've got. You know, go there and like talk to people. You know, if there is an action happening, then, you know, give people the confidence to make it happen. You know, I think that'd be a good place to start at least. And I mean, just the thing with outsourcing, I mean, you know, I'm very much of the opinion that I wouldn't want to be discouraging anybody from getting a test. I mean, you know, if anything, the government needs to know that there's pressure to be creating more tests. And I mean, obviously it's a complicated one because they've sold it all off to their mates in private companies, and, you know, but at the end of the day, like, yeah, I think the last thing we should be doing as a health service is discouraging people from getting tested. You know, it's not their fault that this outsourcing has happened and this cronyism has happened. You know, we need to kind of keep up the demand for more of that to be available.
Thank you, Elly. Yeah, I think that's an important point as well. We don't want to be discouraging people not to have tests, because we really do need to understand what's going on and have that communication. On a local level, though, I think that's also very important. We need to demand that testing be, you know, that responsibility be given back to the NHS. I'm just going to read a comment from Gil McCall. Thank you all for an engrossing meeting. I'm a retired superintendent radiographer. I watched the destruction of the NHS with sheer horror. Unionise urgently. Thank you so much for that. Okay, so I'm gonna have to ask everybody to sum up quickly, not quickly, but sum up please, because we are coming to past, and it's been a long day for many of us working in the NHS, but also you know, we don't want to go on for too long, so I'll hand it over to you guys. We'll start with, and let's go in the order that we started in, if that's all right. Karen, any last comments?
Yeah, just that we need to make colleagues aware that the NHS is being privatised by the back door. It's not even through the back door now. I think they're being quite blatant about it. And we need to encourage those that aren't active to become more active. I work on the ward I work on is quite a lot of apathy at the moment. And I think it's because people just feel beaten down, they don't trust the management, they just don't know where to go and who to trust. So I think it is just laying out and being absolutely clear and using some gentle persuasion and then taking it from there, really.
Elly?
Gosh, I don't know, I hadn't really prepared anything to sum up. I mean, I guess just to say that it's really nice to see that the conversation has been kind of going on in the chat as we've been going, and that you know, there are clearly a lot of actual NHS staff coming to engage with this, which is absolutely fantastic. And I think the more that we can do to kind of raise consciousness of the people that we work with, you know, not just to kind of save the NHS from the current crisis that it's going through now, but actually to think about what a properly functioning NHS could look like. I mean, we're all sick of working in places with these huge waiting lists and knowing that, you know, some of the interventions and treatments that we're able to offer don't even touch the sides of what people need, and, you know, kind of being rushed to finish treatment or intervention with people in like 6 or 8 sessions when actually maybe they need a year or 2 years, or, you know, and just not being able to do that. And I think, like, in responding to the COVID crisis, you know, it's like we don't want to put those questions on the back burner. You know, we shouldn't just be fighting to survive as an organisation, but, you know, should be thinking about what we can do to have a proper, thriving public health service that really meets people's needs rather than just, you know, keeping them alive. That's maybe the OT and me talking. But I really think that is something we can do if we kind of carry on the energy and the kind of new awareness and understanding that, you know, we've gained as health workers throughout this pandemic. Yeah.
Thanks, Elly. Helen?
Yeah, I think we go forward and we continue to build unity and solidarity, and we formulate a set of demands that protects public health and protects the economy, because that's not happening at the moment. We need to be really clear about that. I think that every NHS staff member, whether they're outsourced or in-sourced, can get active, can join a trade union and get active in a trade union, and make sure there's trade union organising going on in every ward, every unit, every community setting up and down the country. And I think finally we need to remember that the interests of all NHS workers and patients are absolutely aligned. So I think, you know, when the unions, unionised, organised NHS workers link up with community campaigns, we'll pack a powerful punch against this Tory government, which I think is really, really important. And we're doing it to keep the NHS, to rebuild the NHS, and for the betterment of the whole of society, actually, because that's what needs to happen right now. So I feel very positive for the future, and I think we go forward with confidence.
Thank you, Helen. Alison, I don't know if you're still there, but it'd be great to hear from you before we finish. I'm not sure if Alison's still there. Maybe not. Okay, well, just before we do...
I am here, sorry, I am here.
Okay.
Sorry. Well, I just think there's so many issues and it's so difficult for everybody. But I think it's really important to organise, not just joining your trade union, which is important for workers' rights, but joining organisations like Keep Our NHS Public or Save Our NHS, or whichever ones are in your local area. And even if you can't be active because you're so busy, I think just giving a little bit of money to keep that going is really important, because the campaigning and the activism on the ground is what really matters. And it's what really unnerves MPs, is when they see that people are very active and filling up their mailboxes with written letters. So keep on going. It's a very difficult time and it's a big fight, but we really owe a lot to people like the other panelists who come and share their knowledge and expertise. So it's been great fun listening to everything, and thank you very much.
Thank you all for your brilliant contributions. It has been really lovely being part of this meeting. I want to also just say to the people, the attendees, there's been some really good contributions. You know, it would be lovely to hear from you guys more often, so please send us emails. Some of the kind of snapshots that I've seen in the chat, I mean, we would love to put them in our newsletter, so please send them over to us, to the email address, and we'd love to get some of those stories into our newsletter. I've noticed somebody's raised their hand. Aha. Okay, so we're not going to take any contributions today, if that's okay, because we've just got 2 more minutes, and I'm just going to make some quick announcements. So just to remind everybody, November 20th, we will be doing a day of action around PPE. We urge you guys in your teams to take a photo, and feel free to anonymize your face if you want, or be open about who you are if you can. We want to see the PPE scenario. What kind of PPE does your team have available to them going forward? I mentioned earlier that some teams of 6 still have only 2 masks, and I think that's actually not the worst case scenario. So what we are planning is to have people post these images on social media on the 20th of November. We're going to provide some images, some graphics, if you don't want to use your own, and we'll provide hashtags, and all of that information will be on our Facebook page, and it will also be sent out to our mailing list, so please keep an eye out and please do sign up. On Saturday, we've got the Trade Deal Day of Action. I've put the links in the chat, so please check it out. We do have an action in London. So as we were talking about actions and getting on the streets, if you are able to do that, if you are not in a situation where you need to isolate, or need, you know, if you don't have any high-risk people in your household, please come down. Please let us know if you can steward. If you are a first aider, even better. Get in touch through the email, through the Facebook, however you can. Join the Facebook page, join Keep Our NHS Public, you know, just stay in touch with us if you can. We want to hear from you guys, we want to communicate with you guys, and we really want to build a network. Thank you so much for joining today's meeting. Thanks again, all our panelists, you really have done an excellent job. Thank you so much. And I will post this on Facebook as soon as I can figure out how. So thank you, and see you soon.